everyone, it's Lorie Brown, and today you're watching the COVID-19 Survival Guide for Nurses and Healthcare Practitioners. And I'm really excited that our special guest, who's been taking care of children, people, humans, babies, animals for her entire life. In fact, at age 13, she had a pet deer. Can you believe it? The name was Bambi, but luckily this Bambi survived because she helped it. Anyways, I'm very excited to have our special guest, Laura Frontiero. Laura, welcome. Laura's a nurse practitioner.
Hi, thank you, Lorie. I'm so happy to be on here supporting nurses and healthcare workers right now. And of course, I'm out there in the health system as well right now as we speak.
Yeah, so you're a nurse practitioner. Can you share a little bit about what you do?
Yeah, sure. I've been a nurse practitioner for 23 years. I've grown up in traditional allopathic medicine. I, of course, started out working as a registered nurse in hospitals. I worked in a lot of hospitals in San Diego, and then became a nurse practitioner and have worked in outpatient clinic setting ever since. And about 3 years ago or so, 4 years ago, I really started to get interested in functional medicine and a more integrative approach to helping people really find the root cause of what their health problems are and heal from the inside out. And one of the reasons I really got into this is because year after year, I was prescribing drugs and ordering treatments and people weren't getting any better. In fact, people were collecting health problems or just staying the same. And there wasn't really enough time in our quick office visits to really dig into lifestyle and how to support a true change in their health, which really got me down a path of studying. There's got to be more. There's got to be a different way. And so really what I stand for, I see myself as a bridge between the traditional model and the functional, more integrative model. And I literally have one foot in both worlds right now. I work in a traditional allopathic clinic. I work in a bone disease clinic. And I also work in my own functional medicine consulting practice, seeing patients around the world and supporting them virtually, seeing patients by phone and video virtually, supporting their health journey. So, I always say that traditional medicine is amazing. If you have appendicitis, you do not need an essential oil. You need an emergency room. You need surgery. You need support. And right now, while we're in this pandemic and we're dealing with coronavirus, we really need to lean on our traditional allopathic medical system right now because there's some incredible treatments and life support that can be provided right now. And also for prevention and keeping ourselves healthy, the functional integrative space lends so much support. And in fact, this is a whole nother topic, but you can use all kinds of botanicals and supplements to actually support antiviral, antimicrobial activity in the body. But today we're going to focus on not getting sick, right?
Right. So how can these nurses who are on the front lines protect themselves and increase their immune system so they don't get sick?
Exactly. This is key because your immune system is being taxed right now. All you have to do is watch the news and your stress levels goes up, immune system decreases, right? It's a direct proportion. Stress goes up, immunity goes down. So one of the very first things is reducing stress. And I know you have people coming on this series talking about meditation and stress reduction. And what I want to invite all the nurses watching this to consider is how important this is, because you will burn out. Because not only are you out there on the front lines caring for people, you're coming home to your families who are looking to you for answers, for support, for guidance, for assurance that everything is going to be okay. And if I know nurses, and I'm a nurse, my mama was a nurse, and I know nurses put themselves last. We take care of everybody else and we're last. So first and foremost, stress reduction. And I can't say enough about that. The second thing is sleep. Our body requires a resting and restorative and rebalancing period every single day. Your liver needs a break from detoxing what's coming into your body so it can start to deal with some of the things that are hanging out in our body, right? So when we're not eating and drinking and moving around, our body can rest, relax, and restore. And so 8 hours of sleep is essential. You know, there's been so many studies on sleep. Sleep is a widely studied area of medicine and health. And studies show, and get this, that people who sleep 6 hours or less per night are 4 times more likely to catch a cold or the flu than people who sleep 7 or more hours per night. That's a difference of 1 hour. The difference between 6 hours and 7 hours is a huge shift in your immunity. Yeah.
Wow, that's so interesting. And we'll have a sleep expert on this as well.
So glad to hear that, because sleep is so precious and you get to guard it. And I know myself, like Lorie, I can go till, and pretty soon it's 11 o'clock at night, it's midnight, and I'm working away on something in my business, which I could just, you know, I could do it endlessly. I could be an endless creation of support and information for my audience, for the people who follow me. And if I don't stop, there's not going to be enough of me to give out to the world. There's not going to be enough of me to give to my husband, my daughter, and all the people who rely on me. So it is essential that we get our sleep, for sure. So I want to talk to you a little bit about today about immune boosting foods. Does that sound okay to you?
That sounds great, yes.
Because I know that in nursing school, we have, you know, a semester of nutrition, and we learn about nutrition, but we don't really learn about how to boost the immune system naturally in our traditional medicine model. And the majority of people watching this show are coming from the traditional model. These are nurses that are out in the clinics and out in the hospitals. And so they've gone through the same education training that I did to become a nurse and then a nurse practitioner. So what I've learned in my functional and integrative training has really come in handy. So first thing I want to talk about is bone broth. So number one, bone broth. And we were just talking about this. I mean, I love making things homemade, and it's super easy to do using your crock pot or your Instant Pot, and throw in some bones and some onions and celery and carrots and let it go. But you can also buy it, as you so eloquently pointed out. They don't have to be. You
don't even have to go to the store. You can order it online.
My overachiever, right? Like, I make my own bone broth. But I also have some on hand that I didn't make that I want to show you. But first, why is it important to have bone broth? And I know you're going to have a gut specialist on here, which is key. I mean, the gut is the center of your immune system, if you will. And so what bone broth does is it really supports healthy gut. It helps support the lining of the gut. Your bone broth is full of amino acids and collagen, which is very gut supporting. So first thing I want to show you is this product by Lono Life. And it is a powdered bone broth. It's not even a liquid. You literally add it to water and heat it. So it comes in these little packets. This is something the nurses can throw in their, you know, lunch bag and have readily at work. And I know all the units, we've got hot water on all the units so we can make tea and whatever, coffee. So bone broth, drink one every day while you're on the unit. This is going to support you. Another option when you're at home, this is actually one of my favorites. It's called Bonafide. It comes frozen. And I buy this locally at Sprouts in the frozen section. And I love the chicken. They come with beef and chicken, but it's delicious. So get bone broth into your body. The next thing I want to talk to you about is ginger. And so ginger has been around for centuries. And the reason that ginger is used in more functional and integrative medicine is it has an antimicrobial quality to it, an anti-inflammatory quality to it. So it really helps support and boost your immune system. So cooking with ginger, drinking ginger tea, you can even get ginger supplements. Last night for dinner, I made a big batch of curry, like total comfort food, right? Like yellow curry with vegetables and chicken. And I got, you know, a whack of ginger and just, you know, you use one of those like little cheese graters to grate ginger and put it right into your food. So you can put it in soups and sauces as well. So add ginger to your diet, very easy to do. The next thing is green tea. Green tea actually strengthens your immune system with antioxidants. And it is a commonly used a beverage that is supportive to you. And that's something we should talk about, is beverages that are not supportive to you. So during this time, we might want to be leaning towards grabbing energy drinks or drinking loads of coffee. And these things can actually be detrimental. And trust me, I love my coffee. coffee addict, I will admit it right now, but I am a 1 cup of coffee a person day to get my day started with my coffee. But drinking coffee all day long can actually be detrimental and hurt our ability to sleep. It takes a lot of time to metabolize that caffeine out of our body. And then with energy drinks, they're usually loaded with sugar or artificial sweeteners that are actually detrimental to our good bacteria in our gut microbiome. And they also harm our immune system and cause inflammation. So you guys, nurses, stay away from the energy drinks and go for green tea instead, because that'll give you a little bit of caffeine boost and a lot of antioxidant. So the next thing is vitamin C. So we've heard a lot about vitamin C in the news right now. And I will say that vitamin C is selling out all over the country. So I work with a lot of online distributors, physician grade supplement companies. And in my normal practice of helping my clients boost their immune system and heal their bodies, we do lab testing. And one of the things we test for is vitamin C, a functional need for vitamin C in the body. And so I recommend vitamin C quite often. And over the last month, I've noticed that as I'm recommending vitamin C products to my clients, you can't get them because that America's buying them up like crazy. So with good reason. So what does vitamin C do for you? Well, vitamin C does a couple things. Number one, it's a natural immune booster. And it also helps with detoxification. And this is really important. It really helps detoxify pathways throughout the body. But here's the mistake people make. They either don't take enough or they take too much all at once and you just pee it out. So vitamin C is a water-soluble vitamin. And the best way to use your vitamin C is to dose it throughout the day. And I know it's kind of a pain, like, you just want to be one and done, right? Just take it. Yeah. But really, if you can take it 3 times a day, that's better than once a day. If you could take it 6 times a day, that's amazing. And so I recommend about 1,000 milligram dose each time you take it. So if you could take it 6 times a day, that's 6,000 milligrams that you're getting in, but you're splitting it up, you're going to detoxify and boost your immune system. So get your vitamin C in. And then for foods that are high in vitamin C, I want to give you some ideas of vitamin C rich foods and some you might not know of. So getting it through food in your body is also a way. So the obvious citrus, but also guava, mango, pineapple, and little known parsley, green and red bell peppers. They also have high doses of vitamin C. So get those things in your body. Yep, you can get it with every meal. And the other thing I should say is C along with zinc has been shown in studies to be beneficial to our immune system as well. And there's so many vitamin C zinc preparations out there on the market. You'll see what's the big one that everybody, Airborne, that's the one I'm thinking of. So it's got vitamin C and zinc and echinacea and a couple of things, but taking zinc along with vitamin C is a booster as well. You can get that at the health food store.
And what about that emergency stuff, the powder packet?
You know, funny, I have a packet in my kitchen. I can't remember if there's zinc in emergency or not, but it's a great source of vitamin C. If there's zinc in it, that's great too, for sure. At this point,
that you know all this stuff, that they don't teach any of this in nursing school.
No, they don't teach any of this. And so I remember I took pharmacology felt like an eternity, but we don't talk about natural ways to boost our body up, right? So we're talking about natural things here, getting bone broth in, getting vitamin C in, getting ginger, and we're talking about how to get it from food. Green tea, it's a food, right?
Right.
Whole concept of food is medicine. Food is our medicine. We just need to know how to use it, how to leverage it in this time. So that's what I want to talk to you about is beta carotene.
Okay.
This helps reduce inflammation and fights oxidative stress. So beta carotene is something that you get in your foods. So your red, yellow, and orange foods and leafy greens are your best place to get this. So a list of foods. So think of foods like pumpkin, sweet potato, apricots, red bell peppers, and then as far as the leafy greens, think of collard greens, spinach, kale, adding those things in to your diet multiple times a day. At least it's a combo of fruits and vegetables, right?
Right.
And the cool thing is right now, our grocery stores actually have plentiful produce.
Yeah.
Wiped the aisles clean of canned foods and non-perishable. But we can actually get perishable fruits and vegetables right now, which is amazing. So, and your delivery services are delivering. So you can sign up for an organic food box and it will be delivered to your door. We have that service at our house. And I mean, they're emailing us right now, letting us know that they've had an uptick in the amount of orders, and to just be patient as they get everything right. They've had to hire more people, bring more people on, and they're like asking for forgiveness if we get your box wrong. Like, we will get it right. Just give us time. So yeah, get your fresh food in. So that's some really good tips for you on how to add immune boosting foods into your daily routine, Lorie.
Yeah, wow, great information. I'm gonna have to order some of that bone broth. That sounds good.
Yeah, it's good. Lono Life. Lonolife. Lono Life. I'm looking for a website on this, but I don't see it. I get it at Sprouts, but definitely get it online.
Okay. Yeah, and if you don't have Sprouts where you live, thrivemarket.com is another place to get some good holistic stuff. But anyways, great information. Now, you said you had 2 feet, 1 foot in the holistic world, 1 foot into the allopathic world. So let's switch to the allopathic world. Yeah. What should a nurse do if they get sick?
Yeah, okay, so this information changes on the regular, right? So based on right now, what's happening in our world today, while we're filming this, which is April 2nd.
Yep.
We're on April 2nd right now. Okay, so as of April 2nd, if you feel sick, first and foremost, stay home. Stay home. I know, now I've heard mixed bag. I've heard my manager right now in my clinic is literally so supportive. He's like, stay home. Do not come in if you're feeling sick. Do not infect everyone else if you have a fever, if you're feeling bad. I've had other nurses say that their managers are really pressuring them to come to work. And I would say, do not succumb to that pressure. You get to protect yourself and the workforce and everyone. Managers are stressed right now. Just keep your cool and stay home. So first and foremost, stay home. The second thing is
staying home anyways, unless you're working.
What most healthcare organizations are doing right now is having you call in if you're feeling symptomatic. So my office, where I work in my bone clinic, shares a wall with an urgent care. Mm-hmm. And I will tell you that ever since this whole pandemic started and the order in California was to isolate, our urgent care has been empty. There's nobody there. Nobody's coming in because people are calling in if they're sick. They're talking to a telemedicine nurse, who is then giving them instructions on what to do. So if you get sick and if your healthcare system is set up that way, call in to let them know what your symptoms are so you can get support. And I would say, don't come in unless you're having trouble breathing. If you're having trouble breathing and you need to have a breathing treatment, or you need oxygen, or you need to get inhalers, then you need to come in. Don't hold back if you're having any trouble breathing at all. But if it's just your typical flu-like symptoms and just feeling sick and cough, stay at home. And
the information that you provided previously on the immune booster will help them get better faster too, right?
Totally, absolutely. And, a lot of the studies on these immune boosters, it'll cut the length of symptoms by a day or two, which is, that's a day of your life back. And yeah. So that's you just feeling better. But what isn't measured in these studies is what's happening on the inside of your body. What is actually happening with your gut microbiome, with inflammation, with your immune system. And that's something that's very difficult to measure because it's just subjective. Like, I felt better a day sooner, but yeah. I guarantee you what's happening inside of your body, you can't measure, and it's helping.
Yeah. Great. Well, thank you so much for these awesome tips. And I understand you have an amazing resource for everybody that you put together.
I do. And so in this time, we just want to be giving as much as we can to support. This is a guide that I've written that's all about detoxifying, reducing your toxic load in your body. So here's the deal. We live in a developed country. We are exposed to chemicals on the regular, all the time, through our water, through the air, through the chemicals that are on our skin products, in our makeup, our lotions, our shampoos, what's in our cleaning products, even our pots and pans, our mattresses, our dry cleaning. I mean, there are toxins everywhere. Your body has to do something with these toxins, and it's putting energy towards eliminating toxins versus putting energy towards boosting your immune system up, or just healing your body from the inside out. So The guide that I put together for you are really practical tips and hacks on how to detoxify your environment, your body. These are things you can start doing right now, even while we're in this pandemic. And so, Lorie, you're going to give everyone a link to that. It's a straight download. You don't need to opt in for anything. It's just yours. Just go to the website and just download it. You've got it. And then if you want even more, you can go to laurafrontiero.com. And on that website, on the homepage, I have a full sugar detox guide because, you know, right now we're in the comfort food zone where, and even I have increased my sugar intake. And I'll tell you that sugar is fertilizer to microbes in the body. Sugar is fertilizer to inflammation. Sugar is fertilizer to bad bacteria in our gut, and it suppresses our immune system. And it's funny, I was watching the news last night, and there's some people doing some amazing work around the country, and they're having people donate money, and then the money is going towards buying food from restaurants and delivering it to healthcare workers. Have you seen that?
Yes, yes.
It's amazing. And they're delivering boxes of donuts and stuff, and I'm sitting there going, oh my gosh, yes, it's comfort food. It feels so good, and like it's hurting your immune system. So just try to back off on the sugar. So if you need support on detoxing from sugar, you can go to my website and download the Sugar Detox 5-day guide there. It's also free. But for this, Lorie's just going to give you the straight opt-in to, or not the opt-in, the link to get that detox. So glad to support on that, Lorie.
No, thank you so much for your generosity. Appreciate it.
Yeah.
And when you feel like eating that donut or that chocolate at work because everybody's bringing it in, just take that little packet of bone broth and make a drink, and you'll feel satisfied, and it'll curb that craving.
You know, I have a good hack for that too. So what I do personally, what I keep in my lunchbox at work, I take my lunch to work every day, and I keep, I bring dates to work.
Oh, okay.
Dates are really super sweet and chewy. They taste like caramel consistency, and they're so sweet, and they really curb that sugar craving for me. And totally agree. Sometimes a salty salt will curb that sugar craving too. So the bone broth, the Lono Life, it's nice and salty.
And the warm water too helps as well.
For sure.
Yeah. Well, great. Thank you. You've provided so much great information. Now, and I'm hopeful that the listeners here will take advantage of it, because we've got to keep you healthy. You don't do it doesn't serve anybody if you're not well. So please use these tips and strategies and be your optimal self, so you can take care of everybody else. Like Laura talked about in the beginning, we have to fill our cup first before we can give to everybody else. So thank you for being there. We love you. We are so appreciate you being on the front lines and doing the work that you're doing. And we are here supporting and are with you. Anything we can do to help, please let us know. And if you're enjoying this video series, please share it. It's empowerednurses.org/COVID. And your colleagues can get the same information that we're sharing with you and get the whole series as well. Thanks again. And thank you, Laura.
Thank you, Lorie.
Bye, everyone.
Bye.